Now we'll move on to Zach Shamberg, President and CEO of the Pennsylvania Healthcare Association. Zach, can you go ahead and get started?
Thank you, Mr. Chairman. Can you hear me and see me?
I can hear you and I can see you. Yep.
Perfect. Chairman Day, Chairman Samuelson, and members of the House Aging Committee, thank you for the opportunity to participate in today's hearing. I am Zach Shamberg, and I'm the President and CEO of the Pennsylvania Healthcare Association, better known as PHCA. We're a statewide advocacy organization representing long-term care, and that includes nursing homes, personal care homes, and assisted living communities. I'm very grateful that Secretary Levine, Deputy Secretary Boateng, and Deputy Secretary Hancock were able to join us today. Because what I'm about to tell you on behalf of all long-term care providers across the state needs to be heard at the highest levels of our state government. Long-term care facilities, specifically nursing homes, have become the epicenter for this virus in Pennsylvania, and they are screaming for your help. The numbers are staggering. More than 500 facilities statewide have reported at least one case of COVID-19, and nearly 70% of all COVID-related deaths in Pennsylvania have occurred in long-term care. Now, with numbers like that, you'd think any state response would not just include nursing homes, but it would make them the focal point of that plan. Yet here we are today. Make no mistake, we knew the risk. The first reported cases of COVID-19 in the United States occurred in a nursing home in Washington state. We knew seniors would be more susceptible to this virus than any other segment of our population. And nursing homes care for those seniors who often have comorbidities and underlying conditions. We also knew carriers of this virus could be totally asymptomatic. In other words, they have the virus but exhibit no symptoms. So a staff member can walk into a facility and by no fault of their own transmit the virus. And we knew the virus was highly contagious, especially in a contained area like a nursing home. And beginning in late February, we warned of what was to come. When the first cases occurred in Washington, we reached out to our counterparts there to learn what should we be prepared for here in Pennsylvania. And we began to work with our state government. And that was early March. Then came the first reported cases of COVID-19. So facilities restricted all visitation, but providers started to run low on PPE. They couldn't obtain the equipment necessary to mitigate the spread of COVID-19. And who actually had the virus? They couldn't test their residents because there were limited capabilities. They certainly couldn't test staff. So we continued to work with state government. And that was early April. And as the cases multiplied, and as staff left our facilities for fear of contracting the virus, and our residents, who were our parents, our grandparents, our relatives, our loved ones, began to succumb to the virus, we went back to state government and we pleaded for help. And that was mid-April. Members of the House Aging Committee, today is May 8th. And the critical initiatives that we are fighting for today are the same needs that we've advocated for since this epidemic began more than 2 months ago. Priority testing for workers and residents, all workers and residents, symptomatic or not. Priority personal protective equipment, critical emergency Medicaid funding, liability protections, and collaboration with state government rather than misdirected regulatory oversight. Now, I can't tell you that any of those needs have been granted to long-term care facilities. Again, the epicenter of this epidemic. Now, you could be skeptical in late February, and you could be hesitant in mid-March, but not in the first week of May. Members of this committee, you've seen the numbers. The data doesn't lie. 70% of all statewide deaths are occurring in these facilities. So what are we waiting for? We must begin testing every resident and every staff member today. It is the key to reopening Pennsylvania. Other states, including West Virginia and Maryland, have prioritized testing in long-term care. New Jersey just doubled their testing capacity. Massachusetts is working with the National Guard to test every nursing home. And Ohio just partnered with private laboratories for more equipment. Here in Pennsylvania, we're exploring pilot programs. That's not good enough for our seniors. We must prioritize PPE to long-term care because even today, providers feel like it's every facility for themselves. But studies have shown that this equipment limits the spread of COVID-19. So if long-term care is truly the epicenter of this virus, shouldn't our frontline staff be receiving priority PPE? That's not good enough for our frontline workers. We must send critical Medicaid funding to nursing homes because the sheer magnitude of our expenses cannot be ignored. Hazard pay, bonuses, wage increases for every staff member, which, by the way, they deserve. Increased costs for supplies and equipment. Increased costs to care for our residents. That's not good enough for providers. And finally, the impact of liability protections cannot be understated. I would ask you to stand up as legislatures in 13 other states have already done and grant liability protections to our facilities. Wednesday's executive order that was issued, that was not good enough. I will close by saying this. This is not over. It's not too late. We're constantly being told that long-term care has been forgotten in this epidemic, and I disagree. I think long-term care has been ignored because the providers and the workers and the residents that I represent are pleading for the things that I just outlined, the critical tools that they need to stop the spread of this virus. This is not partisan. This is not political. These are people's lives. And so far, those pleas have gone largely unanswered. But you can answer them starting today. Thank you very much.
Zach, I'd like to thank you for that testimony, and everyone on the call. I'd like to just say, I've always thought that the Achilles heel of the public sector is that sometimes we have to sit in uncomfortable situations. I think the benefit of the public sector is that we sit in uncomfortable situations, hear information and data like Zach just presented, and then we try to work together to fix and remedy those issues. So I just wanted to say that in my 12 years in the House, I haven't had a presenter present like you just did, Zach, and it creates a different situation and mood for this committee. And that's why I wanted to make a statement in between you and the next presenter.